Officer from Sanjeevani Ayurvedic Medical College to the dais, and Dr. M.M. Salimat Sir, Principal of SDGMC.
Everyone, it is my distinct honor to introduce a towering figure in the field of Ayurveda, obstetrics and gynecology, Dr.S. Dayani Siriwardane, Chairman and Director, Senior Consultant and Lecturer, Osuki Ayurveda Hospital, Sri Lanka. Ma'am has dedicated over 37 years to the medical and academic world. She is a PhD from Gujarat Ayurveda University. Academically, she has been a dedicated educator at the University of Colombo's Institute of Indigenous Medicine accolades, including multiple long service awards from the University of Colombo's and the prestigious Swarna Singhe National Award in 2020. In short, Dr. Dayani Siriwardane ma'am is a pioneer clinician, educator and a researcher whose profound contributions has shaped the discipline of Ayurvedic obstetrics and gynecology in Sri Lanka and the globe and on the global stage. Once again, I welcome you, ma'am, for the session.
Good morning, everybody. Dear senior professors, lecturers, distinguished guests, and all students. So, this is indeed an honor to address you in this seminar, the Gavisiddeshwara 2025 Koushalya Bharati 2025. We must give thanks to the organizing committee because this is a great platform to share our ideas and our experiences in different parts of India as well as in Sri Lanka. So I am from Sri Lanka, and I briefly introduce myself. I am Dr. Dayani Siriwardane, having 37 years of university teaching experience, and I did my MD under Professor P.V. Tiwari, and I did my PhD under Induben Mystery. So my subject is remarkable success of gynecology treatments in Ayurveda with special reference to Uttarvasthi. Actually, I must say the Uttarvasthi where I learned from Gujarat Ayurveda University under Professor Induben Mystery. So that is actually great results I achieved. I just want to just bring forward all those results. So we'll go one by one. So actually Uttarvasthi, as you all know, what is Uttarvasthi? This side. So what is Uttarvasthi? Uttarvasthi means, so the medicines what we prepared, send in, especially the gynecological diseases, it is very useful. So in genital tract, like we are sending it through vagina, then vagina to the uterus, it will go up to ovaries. That is the major part because it's very risky but very effective, I must say it. So because in my MD period, actually my professor didn't that much willing to do it because of the riskiness. But in MD, where I am PhD, where I did my PhD at Gujarat, so freely they use, but means fully sterile process and all the things that means we must undergo. Otherwise, it's very risky. That also you must know. So this is so Uttarvasthi patients. So especially in Sri Lanka, in 37 years, so all the way. So I have a lot of experience having this different kind of, almost I can say all kind of Uttarvasthi, all kind of gynecological diseases, we can use Uttarvasthi, but especially some very successful cases are there, diseases are there that I'll explain you one by one. So actually, since this long period, I had an opportunity to integrate the ancient medical system as well as our new clinical medicine, what we are doing in BHU like. So we get great, remarkable results by doing all the, by giving Uttarvasthi, and the patients we got marvelous results. So especially when treatment procedures are concerned, so we must see I'll explain you one by one. We must see the importance of individualized treatment. As you know, Ayurveda, we can't give common treatment to everybody. So we must see, we must select patient to patient. So no woman will give same treatments. That will differ. How it will differ? Because as you know, we must consider the prakriti and vikriti of the patient. So accordingly, we must select the drugs and all the and as well as dosha type also equally important when we select in the drug procedure before giving Uttarvasthi. So the treatment procedure is equally important. So that's why the prakriti, vikriti as well as dosha type also very important. And the balancing of dosha means, as you know, the vitiation of dosha is very important. That is the major cause for having gynecological diseases. Not almost all, especially the imbalance of dosha will get so many gynecological diseases. So what we have to do is to correct that dosha type. We must see it in a deep nidana, consider the nidana and all type, prakriti and everything, and ultimately we must we must come to the correct diagnosis. That is very important, because you can gain the correct diagnosis only through your experience. That I must say, because now almost 40 years I am in this field. But gradually you also can build in that portion. So today I am here to deliver the successful cases, how I did and everything I'll tell you. The healing power of herbal remedies. In our hospital, we utilize vast array of herbs. Like according to the patient it will differ, but the properties and the patient's history, when we consider, after that we have to select the drugs and we will see accordingly. And suppose if the fibroid cyst or some such type of disease is there, so we must give the lekana, karshana drugs. So we must select. So like that, so the healing power of, we must select the drugs having that property. That is important. Healing power, that herbal remedies, the regulation of ahara viharana, diet and lifestyle modification. So ahara viharana is also Ayurveda mentioned thoroughly. So not only ahara, the viharana is also equally important, because mind-body balance is very much important. So after breaking that balance only, we'll get almost all the diseases. So regulation of ahara viharana is important in that condition. We must give the instruction for them. What are the exercises we can do, and yoga, pranayama, whatever we must advise them. As well as the ahara, type of ahara, what they are, suppose if the patient is having fibroid, we are giving different kind of ahara rata. And the patient is having polycystic ovarian syndrome, so we will give the other. So like poshana, so nutrition, more nutritious drugs. But the other thing, langana, lekana, ahara only we must give, like that. So that, and the other, the deep nurturing of the mind-body connection. As you know, the Ayurveda means always not only the mind, but also the body. Mind-body connection is very much important. So here, the balances of dosha, balancing of dosha and everything when we equally consider, so likewise, so mind and body connection is also very important to undergo. Right? Now this is the Uttarvasthi, how I start. So patient is to be 45-degree inclined position, and before giving major treatment, we must give Purva Karma as well as Paschat Karma for more beneficiary actions as well as less complications. So Uttarvasthi is the Pradhana Karma, as you know. So for Purva Karma, for preparing Uttarvasthi, usually we are Sneha, Sweda, Vasti, so normal Guda Vasti, what we are usually giving. And giving after at least 5-6 Vastis like that, and Sweda, Sneha, repeatedly, Purva Karma, and then only she is ready for Pradhana Karma. Pradhana Karma means Uttarvasthi. So by that time, we must consider about her. She should be not in the menstrual period. So the Uttarvasthi, I think, better soon after finishing her menstruation, and not just before menstruation. It is also not good. In between only we must select her and doing we must give some time to Purva Karma as well as the Pradhana Karma. Pradhana Karma, before doing Pradhana Karma, we must do Purva Karma. Then after doing Purva Karma, we will keep her in this position, and we will, so, and even the supportive treatments also we are giving. So like Nasya, Shirolepa, Shirodhara, Shiradhara, Kashayadhara, Udvartana, like so many supportive treatments are there that will help more benefit, that will give more benefit to the patient. So Pradhana Karma before doing, so we must check everything, almost all. We are doing this Uttarvasthi since 37 years. It's a long procedure, long back. And that's why actually this is the results I can't say in words. That much of effectiveness is there, but don't keep it in your mind. It's risky. It's risky. Always. So I'm giving the instruction. So after having the 25 years, 10 years, 15 years babies, so they are just pay their homage. Means for pay the respect, they come and see the babies. So after long back, more than 10 years usually, giving this Uttarvasthi for different.
Siriwardane for a very wonderful presentation. The organizers have asked me to pass on comment within 2 minutes on this particular presentation. Even though I am not an authority to speak on Uttarvasthi and gynecological problems, but what I have understood by the recent advances and researches and evidence-based presentations made with regards to Uttarvasthi and its efficacy, particularly in female infertility. As all of you know, Uttarvasthi was one of the Shodhana procedures which was very, very rarely used about a decade back, because everybody has their own fear in introducing the medicine in a very sensitive organ like uterus that may give chance to simple infection to shock itself. But adopting Uttarvasthi became very mandatory due to the incidence of increase in female infertility. Because of various reasons starting from PCOS, tube blockage, hormonal imbalance, endometrial thickness, all these led to try Uttarvasthi to overcome the problems involved in the female infertility. Then many Ayurvedic gynecologists started using this Uttarvasthi as an effective tool in the management of many gynecological problems, mainly in female infertility. And whatever the presentations Madam has made with evidence and documentation, that is most important in these days. False claims are not going to be recognized. There must be an evidence and it has to be documented. Hence, all these young Ayurvedic doctors or students who are sitting in this gathering, they must feel themselves very fortunate to see such procedures which are being routinely performed nowadays. And very challenging cases pertaining to female infertility are being addressed. And many infertile women have enjoyed their motherhood. So that's most important. ಮಾತೃತ್ವ ಏನು ಒಂದು ಉತ್ತರ ಬಸ್ತಿಯಿಂದ ನಾವು ಸಾಕಷ್ಟು ಜನರಿಗೆ ಆಯುರ್ವೇದ ಚಿಕಿತ್ಸೆಯನ್ನು ನೀಡ್ತಾ ಇದ್ದೇವೆ, ಅದರಷ್ಟು ಒಬ್ಬ ವೈದ್ಯನಿಗೆ ಮನಸ್ಸಿಗೆ ಆತ್ಮತೃಪ್ತಿ ಆಗೋದ್ರಲ್ಲಿ ಯಾವ ಸಂದೇಹವಿಲ್ಲ. ಐ ಒನ್ಸ್ ಅಗೇನ್ ಕಂಗ್ರ್ಯಾಚುಲೇಟ್ ಮೇಡಮ್ ಫಾರ್ ಟ್ರೆಮೆಂಡಸ್ ವರ್ಕ್ ಆ್ಯಂಡ್ sharing her knowledge with the... Thank you, one and all.